come to order. Will the clerk take attendance?
Chair Neely,
Here.
Representatives Farhat,
Here.
Rixey,
Here.
Carter,
Here.
Witset, Grant,
Present.
Price,
Here.
Van Workum,
Here.
Markkinen,
Here.
Outman,
Here.
Tisdale,
Here.
Bodley.
Here.
Madam Chair, you have a quorum.
Thank you. Vice Chair Farhad makes a motion to adopt the minutes from March 15, 2023 meeting. Without any objection, the minutes are adopted. For today's agenda, we would have testimony from amendment on House Bill 4068, the blood donation tax credit bill. Rep. Hood, can you please come up? Thank you.
Thank you, Chairwoman Neely. I'm so excited to be here with all of you today. Great to see so many colleagues on this committee and have a chance to talk about the importance of this bill. So thank you again for that opportunity. I brought this bill forward with partners in our community, namely Versity Health, who is here with us today and will testify. I also wanted to share a note of thanks with Corewell Health, who is here to support this work, and Diane Kalmus, who came in all the way from the district in Washington, D.C., from the American Blood Center to help Michigan move forward. I think it is astounding to have those folks here, and obviously an indicator of the significance of this bill, but more importantly, the issue that this bill seeks to fix. So thank you again for being here. My bill would provide Michiganders a tax break on all blood donations made in the calendar year. For each verified blood donation, a taxpayer would claim $25 in a tax credit up to 6 times, which is aligned with the recommended amount of times that an individual would donate blood in a given year. So that's a total of $150 back in tax credits for their charitable donation of blood. So we do know that people give blood and plasma, and a for-profit center, this would be focused on those nonprofit centers like Versity and Michigan Blood, who operate here to help us keep an appropriate amount of blood available to the people of Michigan in the case of emergencies, accidents, and then ongoing needs from chronic diseases as well. Tax credits will obviously help Michiganders save money and incentivize giving blood. We've seen a significant drop in blood donations, particularly after COVID. COVID disrupted many blood donation drives in any number of places, churches, high schools, etc. And now at this time, we have a critical blood shortage, less than a day of blood available to the people of Michigan. And the best practice, I'm told, is to have up to 3 days of blood available. So we have a critical need and shortage, and this is one tool that we can use, and it's a proven tool that's been used in other states to incentivize people to donate blood. Of course, like with any bill, we have to look at policy from all sides and consider its implications. And there are important factors and various financial and budget elements that we have to consider. This would be a credit that would affect income tax refunds and would have an impact on the general fund. However, it would have a benefit to our economy in helping to move procedures forward faster. And then obviously, we're talking about keeping people alive here. And I will share a personal story, but I want to finish my formal talking points first. Given the economic, this would be, in addition to, the burden on the general fund, we know that this, would help to pay for itself by accelerating procedures and accelerating the healthcare economy as a whole. And obviously a win-win-win at a time when we really need blood. So given the economic stimulation factor and the crucial aspects of these donations to save lives, this legislation is a positive step forward for Michigan. Blood donations help Michiganders save lives, and tax credits help Michiganders save money. It's sensible legislation and all around advantageous for our state and our residents. Over the last 2 years, many of you know I lost both of my parents. During that time, my mother in particular had a rare blood disease, aplastic anemia. And for the last year of her life, really about 9 months, she was dependent on blood donations in order to survive. So when we received that terrible diagnosis, that came too late in her life for her to be able to do a bone marrow transplant or some other means to address this chronic disease. Blood donations quite literally gave my mom 9 months more to live, to enjoy our family. In those moments, I committed to making sure we did more to address this issue so that others could have that benefit of enjoying their family members just a little bit longer. And I appreciate your support and helping hands and moving that forward. And with that, before I find my tissue, I'd like to invite Sue Smith from Corewell Health. She is the Vice President of Lab Services. I want to thank her personally because the blood that my mother used during those 9 months went through her department, and it was their good work keeping this supply under control that allowed her to survive. And so that is my thank you and my moment of gratitude for her, and I'll invite Corewell to join us. Thank you.
Yes, you can. You can. Can you come back for a second? Rep Hood, they want to ask questions.
Sorry, we did prepare to do questions after, but I'm happy to take.
I'll be really brief.
Yeah.
Sorry to drag you back up here.
Thank
First
you,
of all,
Rep.
I want to really my sincere apologies to the passing of your mom. That's tough. I'm sure she was a wonderful lady. She raised a wonderful daughter. I really enjoyed working with you.
Thank you, Rep. Outman. Sweet.
Obviously, the main intent is to increase participation in blood drives. And I think you touched on this, so I apologize if this is a little redundant, but how much has participation decreased? I mean, obviously, you brought up COVID. It's certainly decreased a lot since then. But
Yeah,
can you give me a little, kind of paint a picture there for me?
I
about
would actually defer that question to the blood donation groups. Versity is here to testify, and I think that they have data to speak to those more specific questions.
Sure.
Okay, they can come up now.
Okay, great.
Thank you guys for coming, and welcome to Tax Policy. You can start when you're ready.
I'm Susan Smith and Dave Baradello. And first and foremost, I wanted to thank you, Chairwoman Neely, and members of the House Tax Policy Committee for giving me the opportunity to testify today for support of House Bill 4068. My name is Susan Smith, and I'm the Vice President for Lab Services at Corewell Health West, which was formerly Spectrum Health. House Bill 4068 will assist hospitals as well as healthcare providers who have experienced consistent blood shortages. The availability of blood is critical and essential for us to save lives by operating our trauma centers, our transplant programs, cardiology services, and surgical services. Both O-positive and O-negative red cells are critical for our ability to maintain a comfort-based number of products in stock, and that has not been achievable since the start of the pandemic, around 2019. There have been countless times in the last year that our blood bank leaders have had to make calls to our regional sites who stock very small numbers of those products and ask them to send them to Butterworth Medical Center so that we can provide the supplies to our partners and provide a safe number of products to support trauma and surgery. So that's a difficult situation. Recent platelet and blood shortages have at times required us to have a pathologist review and approve for transfusion. This all slows down our ability to provide products in a timely manner for our patients' needs. We've worked very tirelessly at Corewell with our blood program to support their efforts in our hospitals and our associated locations, but we need more help. That is why I'm here today supporting the House Bill 4068. One blood donation can save 3 lives. Just think, if House Bill 4068 could impact 50 people, that's 150 lives that could have been lost due to blood shortage. Thank you again, Chairwoman Cynthia Neely and the members of the House Tax Policy Committee for the opportunity to speak to this important issue. We are passionate about it. I'm very happy to answer any questions or also continue to offer any answers following our meeting today. Thank you.
Rep. Hood, would you like to join them, just in case anyone has any questions for you also? Do we have any questions? Rep. Markey?
Thank you, Madam. Thank you, Madam Chair. In your professional opinion, do you feel $25 is adequate for a tax credit for blood?
I think it's a start in the right direction.
Okay.
Honestly. Incentivizing, I mean, our diversity team, we incentivize with T-shirts, with all sorts of things to encourage people. But $25 is a start in the right direction.
Because I know in other states they have a blood donor program where if you donate on a regular basis, you and yourself and your family are covered. And, you know, that avoids the tax credit thing. But thank you.
Rep. Farhat?
Thank you, Chair. First, I do want to say, Representative Hood, thank you so much for sharing your story. I want to echo what Rep. Outman said. It is, a pleasure to work with you, and your family has a lot to be proud of. I'm sure your parents do. The crisis that we're seeing now in our health centers, are we seeing patient, whether it be procedures or treatments being delayed as a result of this shortage? Are we seeing patients have to go on longer without potentially having a surgery done or a procedure done because of this shortage? Are we seeing that happen?
We have, absolutely. Absolutely.
Yeah.
And it ebbs and flows, but we have a dashboard set up on a daily basis of what availability our products have. So if it's red, means very low inventory, yellow, still below inventory, and then green obviously is what we'd like. But we have a daily dashboard that we watch to know where we're at risk with regard to supporting our procedures.
Thank you.
And I'll just add that there were times when my mother had to wait a day or two. I mean, the supply chain on this is really complex. Obviously, the movement of blood from, the Versity facility to the hospitals, but then also triaging the patients, right? So it depends on who comes in with what injuries on a given day, whether or not blood is available. For my mom to wait 2 days meant that she couldn't go anywhere, because if she had any fall or accident or injury, she would not be able to get blood. So she was further isolated, and she would, in this particular case, lose the ability to breathe. So her dependency on oxygen would increase with the lack of availability of blood.
Chair, if I may, just a quick follow.
Yes.
That brings up an interesting point. These delays are leading to patients waiting longer. I'm assuming there's a cost associated with this treatment, right? Or the lack thereof. And are we seeing that matriculate into actual prices, or not even prices costing more to treat patients because they're waiting longer to get blood? Is that something we're seeing as well?
I mean, if you came in as a trauma, for example, and we didn't have enough of your blood type, like O negative, it could impact your life, period. So I would not be able to speak to the actual dollar impact, but it is a significant impact to patient care, as well as treatment of our oncology patients, platelets, It's all the different products that we make from one unit of blood. It's not just red cells, it's platelets, it's fresh frozen plasma, cryoprecipitate. All of those products are made from the collection that Versity supports.
Yeah, and if I could add to that,
Can you hit the right button for me?
and if I could add to that, it's the blood that's on the shelf that helps save lives, right? So we've got to have adequate inventory, and it's accounting for those highly unanticipated but high-use situations, which we call mass transfusion protocol. So you might have a liver transplant, and if everything goes well, it might require a few blood units. But when that goes catastrophically bad, it would not be unusual to require over 100 units of blood for just one patient for one particular situation. So how do we create a sustainable blood supply that's on the shelf available for Sue and her team to respond to these emergent needs? That's really what we're trying to address here.
Corewell gives, on average, a year about 1,700 to 2,000 donations to patients. So a fairly significant number, but one that we've really had to meter it. We're having to be so careful. It's difficult.
That's right.
Rep. Tisdale.
Thank you, Chair Neely. Just a couple of quick questions. Maybe for Versity, this is for uncompensated blood donations. There are centers in Michigan that compensate, I think, up to $50 at the time of the donation. Are those compensated blood centers currently maxed out? Are they at capacity? And so we need this incentive to get maybe the uncompensated benefit realized, at least at the end of the tax year. And secondly, we have an amendment in front of us here that talks about, this is for whole blood donations, which is 6 times a year. The apheresis platelets can be up to 24 times a year. Is there a shortage in those apheresis products as well, and should this be expanded to those?
Yeah, thanks for that question. I'll take it, but Sue, please jump in here as well. So to distinguish between the two different types of blood centers you're talking about. So when you say blood center, that's really all blood centers in the U.S. are nonprofit. Some of those centers that do compensated blood component donations are plasma centers. These plasma centers are run by for-profit pharma companies that make medicines out of it, right? So for us as a community-based nonprofit, so as is Red Cross, who is the other supplier for blood in the state of Michigan, we do not compensate donors. We might do a gift card as a short token of appreciation. We might have a T-shirt, as Sue was mentioning, but I think this would be another way to elevate the importance of it and to have another way to inspire those who wish to make blood donations. And our goal is really to reach out and bring new donors who have, first-time donors, as we call them, who might not have donated previously. Rep. Outman, to your previous question, we're seeing a consistent decline over the last 3 years. We've seen a decline of 23% in first-time donors. And as long as you don't have new donors coming in, you have blood donors that are either aging out or are deferred because they're on certain medication. And so we need this constant inflow of new donors coming in. To your next question about the apheresis, that's something that's really good. Right now, the bill is at, for up to 6 donations a year. I believe apheresis would qualify in addition to whole blood donation, but I would defer to Rep. Hood for those details.
We did clarify whole blood because there was an interest in creating a limit, and the most logical limit was the 6 whole blood donations in an effort to create a reasonable ask of the general fund and a more predictable one.
Okay. So basically, the compensated donations are blood products that are then go off for pharmaceutical refinement.
Correct. Yeah, that's for plasma donations. Right. Yeah, which is different than what we're talking about here, the apheresis and whole blood donations.
And as far as the apheresis products, we're okay with those, or is there a shortage as well?
Better than we have been. We're doing better.
Okay.
But that also ebbs and flows, right?
Yeah.
Yeah, I'm sorry. Yeah, we're better, but it does ebb and flow. And we've definitely had challenges where we've had to manage oncology platelet orders because of lack of service, but
And I thank you, Rep. Hood. I do get it. There is a budget consideration in all of this. However, there's a need consideration. It's a balance. So thank you very much.
I honor that balance. It was difficult to come to these decisions for sure, and you know I'm certainly open to creative solutions, open to opportunities.
Rep. Van Wagner.
Thank you, Madam Chair. I have just a couple questions, maybe more related to process and some of the numbers here. One, has Department of Treasury weighed in of whether they support? How do you anticipate the process? Are people going to then get a receipt every time and then we put that with our filing? And then on top of that, is there going to be a budget consideration to implement this? Because we've done several different tax credits or changes, and then Treasury insists on having funding associated with that to change forms and stuff like that. And then my final is, what kind of impact will this have on the student aid fund?
Great. So we have had some initial conversations with the Treasury Department and anticipate that this cost will be around between broadly 10 and 15 million a year is roughly what we have, 15 million being high. Thomas is nodding his head. And then, yes, as you described, we envision a situation where the agency who is receiving the blood donation would, do a small piece of paperwork, a small receipt that an individual would be able to take forward as a document to certify that they had given that donation and apply it to their tax documents, like you would, a receipt from I just gave to the Literacy Center of West Michigan. So for my $60 donation, I would have that available, right? Same idea, essentially, same concept. And then you asked a question about how this would affect the school aid fund, and I'll turn it to your team on policy to answer that. I'm not quite sure.
I can answer that for you, Rachel. It's roughly about 25% of the cost that would hit the school age fund, and then the remaining amount would come through general fund. And I did talk to Treasury yesterday, and right now they have no position on it. Do we have any other questions? All right, I'm going to turn it over to you to
Excellent.
finish up.
Thank you, Chair Neely. So I'll go through a couple of comments, but please keep the questions coming. I want to make sure I address anything that might be on your mind. My name is Gitesh Dubal, and I'm the Executive Vice President for Versity Michigan, and I'm responsible for recruiting blood donors. We hold a foundational belief that blood and life are both interconnected and precious gifts. Blood that is transfused into patients, it's not manufactured in a lab. There's no factory where you can make it. It comes from healthy volunteer donors like you and me. The blood that is needed to save the life of fellow Michiganders who are patients in need of transfusion, such as cancer or sickle cell patients, victims of trauma, it must be given by a donor. Versity is a 501c3 nonprofit organization that focuses on all things blood, from collecting blood to diagnostic testing, research, and more. Versity is one of two primary blood providers to hospitals in the great state of Michigan, American Red Cross being the other one. Versity is fortunate to call Corewell, Henry Ford, Ascension, and many other hospitals in Michigan as our clients. I'm here today to ask for your support for HB 4068 because it will help save the life of Michiganders. The widely accepted standard for a state for adequate blood supply is to have about 3 days of inventory. That's the scorecard that Sue was talking about. Carrying these inventories at these levels helps ensure that blood is reasonably available for predictable patient needs, but also for those unpredictable needs that I talked about, such as a liver transplant going bad, or a childbirth going terribly bad, or a mass transfusion event such as multi-car collisions, train wrecks, and so on. For each of the last 5 years, the blood demand for hospitals in Michigan has exceeded the supply available within the state. And this gap has resulted in less than a half a day of supply available on many days, especially in times that are challenging to collect, like around the holidays, 4th of July and Christmas holidays being the most notable ones. Most recently, the shortfall has been about 15,000 units of blood annually, and it could be as high as 60,000 depending on the year. The average transfusion patient needs 2 blood units. So when you take the 60,000 units and divide by 2, this could potentially put about 30,000 Michiganders' lives at risk. So this is no small challenge that is in front of us here today. The model is, we often import blood from other states and kind of move it around to where the needs are, but it's not sustainable because you're only kind of delaying the inevitable. Blood levels at blood centers and hospitals throughout the Michigan state could drop to below this level. That's the risk that we have, and that's where we feel that this bill will help us as a step in the right direction to address it. Over the last 3 years, first-time blood donors across the Midwest have declined by 23%. Rep. Outman, to your question earlier, and this is unsustainable, and an intervention is essential. You can't, to donate blood, you have to go somewhere. It can't be done by an app. You can't call it, you can't do it like Uber Eats, right? You've got to go talk to somebody, and you need a phlebotomist for it to do it. And so because of that, I think this bill will help increase awareness. It will be another way that brings education to the community for those who are not donating blood. And Diane has some important statistics that talk about, in spite of how many people are eligible to donate blood, so few actually do. This trend is why other states like Oklahoma and Wisconsin have recently stepped forward to offer tax incentives or grant programs to businesses. HB 4068 affords Michigan the opportunity to advance transformative healthcare policy and to avert what otherwise could become a healthcare crisis by being the first state in the nation to provide tax credit directly to the donor. So this would also be a great way for the state of Michigan to stand out and taking a stand on something that is so important. This legislation would also put blood donation on equal footing as donations that you would make to other charities like Rep. Hood just talked about. We know that based on programs that are in place elsewhere and incentives can and do drive blood donation. Is this adequate to your question? Time will tell, but it's definitely a step in the right direction. Versity is confident that the $25 per donation tax credit will enable Michigan to close the gap and start making progress in the right direction. I ask that you join me in supporting HB 4068 so that it can advance to a vote by Michigan legislature. I would like to thank Rep. Hood and Rep. Green and their leadership in proposing this, and I'd also like to thank Sue and Corwell for being here, and Diane for being here, and Chair Neely for your time. Thank you, and I thank this committee for giving us the opportunity to share more about this bill with you. I will pass it on to Diane Kalmus, who's here from DC. She represents America's Blood Centers, and glad to take any questions you might have. Thank you.
Thank you so much, and thank you, Chair Neely, and to the members of the committee. My name is Diane Kalmus, and I'm the Senior Director of Federal Government Affairs for America's Blood Centers. America's Blood Centers is a national organization that brings together the community-based blood centers that collect about 60% of the U.S. blood supply, including right here in Michigan. I ask that you support HB 4068 because it'll save lives and improve lives right here in Michigan. A safe and available blood supply is a core component of our nation's healthcare system. A wide range of patients need blood transfusions every day, including new mothers who experience complications during delivery, cancer patients who require blood as a regular part of their treatment regimen to continue with their treatments, people with sickle cell disease or thalassemia for whom blood transfusion is one of their only therapeutic options, and trauma victims who experience significant blood loss, patients that require surgery, and many others. In fact, a blood transfusion occurs every 2 seconds in the United States. Blood is a unique product. It can only be provided by altruistic donors who are willing to roll up their sleeves and literally give of themselves to help someone in need. Blood is a living substance with a short shelf life, which means a continuous supply of donations is essential to ensure that when a patient is in need, blood is available. While 62% of the U.S. population is eligible to donate, only about 3% of the U.S. population donates in any given year. The pandemic has accelerated the changes to the way that blood is collected. In Michigan and across the country, we've seen a decrease in the number of blood drives hosted at schools and workplaces, and centers are increasingly reliant on individual blood donors coming into their fixed blood donation sites. As a result, at various times, the supply in Michigan has been well below the level that's widely agreed to be necessary to handle any emergency requiring blood to seek products from outside of Michigan to fill in that gap. It's important to remember that when we talk about the nation's blood supply, the blood supply is truly local. The blood collected here in Michigan largely remains in Michigan to transfusion into patients right here in Michigan. There is some blood from other blood collectors that is available to be imported, but this is contingent on those blood suppliers having a surplus. While the majority of community blood centers are able to meet local patient needs, increasingly fewer centers are able to collect more than their local communities require. This puts states like Michigan in jeopardy because of their reliance on imports to meet demand. Unfortunately, the donor base is aging, with nearly 60% of the blood donations come from individuals over 40 and 45% coming from those over 50. As we are seeing concerning decreases in donations from young donors, between 2017 and 2019, there was a 15.1% decrease in donations from those 19 to 24 years old. This lack of donations at younger ages is a concerning indicator that those individuals will donate later in life at rates sufficient to replace donors as they age out. Outside of demographics, blood centers nationally have experienced a decline of 22% in the total number of first-time donors between 2019 and 2022. This trend is seen through the country and is a concerning indicator of the future availability of blood supply sufficient to meet patient needs. The tax credit in HB 4068 gives a promise to change that trend here in Michigan. We've seen tax credits focused on incentivizing business drives in other states to help blood centers scheduled blood drives and bring in necessary donations. However, HB 4068 is different in a very important way. It is in line with the changing way that blood collectors are collecting, and that is that it is incurring at the individual level instead of just at the business level. You have the opportunity to incentivize Michiganders in taking care of their community by donating blood. I ask that you join me in supporting HB 4068 so that it can advance to a vote in the Michigan legislature, and applaud Rep. Hood and Rep. Green for their leadership in proposing this important bill. I ask you to vote to help blood centers save lives of Michiganders.
Thank you so much. Is any other questions? Rep. Hoadley.
Thank you, Madam Chair, and thank you, Representative Hood and Green. Your intentions are admirable. Certainly understand that. My question would be, what is our intended goal? I mean, as far as a base number of how many donations are we trying to increase this by, and where are we short now as far as overall blood donations?
Yeah, I think that's a great question. One of the things that we talked about is the projected shortfall could be as much as 60,000 units. Wouldn't it be great if we could overcome that? I think there's a little bit of an aspirational element to it, but that's where we need to start with this and see what else we could do. But if you were to ask me, Rep. Hoadley, the goal would be to impact 60,000 units and make sure that we are self-sufficient within the state of Michigan.
Thank you.
Any other questions? Go ahead, Rep. Hood.
Thank you, Chairwoman Neely. I just wanted to add as a final comment that on May 18th, Versity will be here to do a blood drive in the South Stateroom at Heritage Hall. So I hope you and your offices can join us and engage other folks in the Lansing community to make sure that the state legislature is showing up for our blood drive and make it well worth it for Versity to come here and set up. Thank you.
Well, I would like to thank all of you for coming out and testifying today. Thank you, Rep. Hood, for doing this. This is one that's near and dear to me, too. So, I went through some things with my sister who also needed blood, and she's no longer here. But this is a very important bill, and I thank you so much for bringing it forth. And thank you all for coming again.
Thank you.
Thank you. We have some cards to read in. To support the bill, we have Michigan Association for Local Public Health. Support of the bill is Trinity Health. Also in support of the bill is Michigan Health and Hospital Association. Also in support of the bill is Hill and Dale Healthcare. Also in support of the bill is Brandon Healthcare Group. Also in support is Ascensions. Also in support is University of Michigan Health West. And also in support is Henry Ford Health. Thank you all for your supporting of this bill. Now we have Rep. Grant, who's offering an amendment to House Bill 4068. Rep. Grant.
Thank you. I would like to offer an amendment on page 1, line 2, after 2023 by inserting and subject to the applicable limitations in this section. Also, I would like to offer an amendment on page 2, line 1, after the word section by inserting an individual taxpayer shall not claim a credit under this section for more than 6 verified blood donations in a single year.
Thank you, Rep. Grant. Mr. Clerk, please take the vote.
On the motion to adopt the amendment, Chair Neely,
Yes.
Representatives Farhat,
Yes.
Brixey,
Yes.
Carter,
Yes.
Witset, Grant,
Yes.
Price,
Yes.
Van Workum,
Yes.
Markkinen,
Yes.
Outman,
Yes.
Tisdale.
Yes.
Madam Chair, you have, Hoadley.
Yes.
Madam Chair, you have 11 yeas, 0 nays, 0 pass. The amendment is adopted.
Thank you. Representative Farhat makes a motion to excuse absent members. Without any objection, absent members are excused. There being no further business before this committee will stand adjourned. Thank you.